Welcome back. Now, if you have questions about Medicare or individual and group health insurance plans now during this open enrollment period, one national insurance brokerage firm based right here in Tucson actually wants to make sure you are on the right plan for your needs.
Colleen Gimbel with Berwick Insurance Group is here to tell you everything that they offer. Colleen, thank you so much for being here.
Sure, thanks for having me. I'm excited to be here.
Of course. So tell us about Berwick and how long have you been around?
Well, we've been in Tucson for over 18 years. We're a national company, but our roots are here. We live here. We're from here. We're Wildcats. So we're excited to promote Berwick Insurance here at the local level. So we spend a lot of time doing it nationally, as you probably can imagine. So.
And this is the perfect time for you to come on because, like we were saying, open enrollment is on for basically everybody.
Yep.
But we do have Medicare also going on right now, which is a big deal for a lot of people.
Yeah, and I think the biggest thing with insurance is that people just don't want to deal with this by themselves, and they don't really know where to go. And a friend of mine told me last year that her husband went online and did everything himself, and then next thing you know, she doesn't have any of her doctors, her kids don't have their pediatrician. So the best thing about what we do is that we represent basically all the major carriers. So if you come and work with one of our agents, then we can look at any plan, as opposed to if you just work with or go direct by yourself, you don't really know what to look for. And that's really where our expertise is that we're looking at how can we find the best plan. We can review plans, make sure they're on the best plan, and just really take care of people. And that's really what we do.
That's amazing. So because as we've been saying it for weeks now, we're just inundated with information in our mailboxes, our email inboxes are full, and there are a lot of questions that people need to ask. So Berwick kind of helps answer those questions and then kind of walks you through the process.
We do, and I think the biggest problem is with Medicare recipients or Medicare eligibles. They have more mail. Most of the time when our agents show up to someone's home, they have bags full of mail, and they're just like, I don't even know what to say or do or where to start. And so having someone that you can go to that's a professional, that really understands what you're doing, that's an expert, that knows the differences between all the plans, that's where that's where we shine. That's where we're able to help the clients get the best plan for them, which is scary because you're locked in for a year. So once you get on a plan, you're with that plan till next year. So you want to make sure it's going to cover everything that you have to have.
And I'm going to be honest, I've been picking insurance plans for more years than I want to say on television right now. And I even noticed that there is a huge swing in things changing, different the way, I feel like you're like, this is not how things used to be. So I think the more education we have on what is now available, if last year I thought, oh, it was fine, or whatever I want on was fine. Don't be that person that gets locked into something that has now changed or done something like that. So we come to you, you help us, but now I'm going to ask, do you cost money for any of these services?
Not a thing. So the carriers to help us help the client. So the client comes to us for free, and if they don't buy a plan, it doesn't cost them anything. If they buy a plan, it still doesn't cost them anything to use our services. So we're able to look and sort of shop around what the best rates are, what your needs are. So everybody has different needs. So you might be really attached to your doctor, and you might be in some sort, especially with Medicare, people are using their insurance a lot more with Medicare, and they might need a specific hospital or whatever the case may be. So the biggest changes that happen every year are networks change, doctors come on and off the plans. So we're able to really look at what are your needs? What are your needs for the next year? If it's a family, what does everyone in your family need? So, and I can't tell you how much, like I said, my friend told me all of their doctors were not on the plan that her husband picked online. And sure enough, she called me and said, okay, what do we need to do now? I was like, come in and talk to an agent because you need to have that. And with Medicare, we use insurance more. The longer, Americans are living longer, which is really great. But unfortunately, we have a tendency to live longer sicker. So you want to get a lot of those extra things that come with the plans that we know and we can represent for the clients.
So I love we know who to go to with all of these questions.
Yeah.
But Colleen, let me ask you just like a couple of tips. What are the things that we really should know about our health insurance plans?
Well, you should know how much it costs. You should know if there's any deductibles. You should know if there are what doctors or what networks are involved. Because that changes constantly. Again, it depends if that's a really important thing to you. For Medicare, prescription drug plans are huge, so you really have to make sure that your drugs are on the right plan. The other thing that happens, and I won't get too technical, but there's with Medicare and prescription drug plans, there's different tiers of drugs. So a generic is a tier 1 may cost you very, very little, a couple dollars for a month prescription. But then if you're on, another plan, it could be a tier 2 drug and it's costing you $10. So every carrier has a different formulary for their prescription drug plans. So you want to make sure, especially with seniors, because we're all on, a lot of drugs and people, and not in a bad way, but in a good way, people are, that's probably the most important thing that they really have to think about. And every company has a different formulary for their drugs, so it could cost a lot less with one company than it could another. So it's technical. There's a lot involved with it.
Well, anytime something is really important in your life, you want to go to an expert to help, you do it. You don't want to have to sift through everything and whatever. That's what you guys are done. So I'm actually going to tell everybody how they can actually have their insurance reviewed with you guys. But I want to thank you for coming and just
thank you so much.
Everything. Colleen, you were great. Now, to get your plan reviewed before it's too late, call today to speak to Berwick Insurance agent. Their number is 745-2300, or you can log on to WeKnowHealthInsurance.com.